My name's Richard. I have 3 kids, and I'm here talking today about Roxy. Roxy had anorexia when she was 14. It was a pretty tough time for her and for everybody else.
Roxy Salmon, and I'm 17 from Sydney, Australia. It escalated quite fast, and it was really a vicious cycle because I think the more weight I lose, the more happy I'd be, but the more weight I lost, the more upset I would be with myself.
My name's Michelle Sperling, and I'm a clinical psychotherapist, and I'm the manager of the recovery support services at the Butterfly Foundation. A lot of people who are experiencing eating disorders are often in denial or ambivalent to getting support, and often this can go unrecognised.
I was kind of in denial a little bit, I have to say. My wife was very much onto it and very proactive. We recognised that it's like, you know, it's an illness like any kind of illness. And she got professional help, which was a psychologist, because it was kind of like a life and death situation. It really is. And you just stop everything for that.
So for parents, some signs that they would need to look out for would be lack of energy, changes in their behaviour and relationship with food, rapid weight loss or changes in weight fluctuations, rigid thinking, the black and white thinking.
Hi, I'm Danielle. I was 19 when I was diagnosed with an eating disorder, anorexia nervosa. Before I knew it, the disordered eating and the over-exercising just took control. So I was starting to do things like label foods, good or bad. I was really rigid with my eating. I had to eat at certain times every day, and it just controlled my life. It just became a really toxic way of thinking, and it created a real tension in the home.
A lot of kids do it secretly, so I feel like the most important thing is tell your parents, because they will be the ones that need to take control.
Some really helpful things to remember is to reach out to the person, to communicate with them, to talk about their emotional state rather than their weight, shape or appearance, to also not want to instantly change any behaviours or fix the problem, and to remain calm and non-judgmental. Things we suggest to avoid to parents is to be critical and to try and find a solution for the problem, rather give an open space where somebody can come and talk about it.
The moment I spoke to someone who I knew was there for me, a weight is lifted off your shoulders, because it now no longer is just you dealing with this, but there's someone to guide you along the way.
Initially, speaking to a GP or a health professional is a really important first step for carers. The treatment for eating disorders often involves a multidisciplinary team of a GP, a therapist and a dietitian. It's not a one-size-fits-all approach.
My therapist was obviously great, but my dietitian just created this amazing environment where I felt in control, because it was my choice. You know, go home and try in 1 week to have a yogurt, and there was never you have to have it every day. It was step by step, and I felt empowered when I did it once.
I learned a lot of mindfulness techniques. You imagine a river and you put the thought on a leaf in the river, and then you just watch it flow away. My psychologist would always say to me, you know, when you'd have that voice in your head telling you, you know, you're too fat, you can't eat that, you're fat, just that constant voice, you'd have to stop and say, that's not me, that's not my voice, that's the eating disorder talking, that's her talking, it's not me.
Jump onto it. If in doubt, get onto it straight away. People don't realise how severe it is and think they can maybe work around it and they can take shortcuts and it'll be okay. And I don't think you can risk it. You can't just have life as usual and continue on and support someone like that. It doesn't work. And if it's life or death and you think of it like that, you will do anything to save a child.
It's really important to say that recovery is 100% possible. The process and recovery journey is not a linear one. It is up and down. Getting the right support is paramount. So as an adjunct to the treatment process, Butterfly offers a suite of programs and services for those experiencing an eating disorder.